novel on that they put in all the information for any contracts, insurance contracts that the facility would have. They would put in all the requirements, billing requirements, and it would almost check the bill before it goes out to make sure that we met all the requirements. We would be billing accurately, not just billing and seeing what's being collected. And so the contractual allowances be included. And then when you look at your AR is accurate. And so that money that looks, you see that's going to be collected, that is real money. So my thing with that is technology has come a long way, and we shouldn't be having everything piecemealed. Everything should be concise, and they do offer training and sitting through the webinar to help the facility. It shows you the money that's outstanding, any issues with any claims, it gives you a heads up. And so in all reality, it's kind of TCM all wrapped up in the software. And so because of the census, because it is a county-owned home, I know they look at, costs. And I guess I just feel that the building is not getting the training. Jennifer doesn't have access to everything. She has not built independently. And right now she is overwhelmed with AP and the business office. It is impossible for one person to do that job. Impossible. And even though I always volunteer myself, if I end up doing something else, then now, she's left to do it. And that's why everything is as, delayed as it is. So again, technology is our friend. We have to find something that would help the facility to be able, the billing happens in the building. We are the ones that are in control of that. So TCM bills it, but it starts from admissions, making sure that the person has, the insurance, the days available, and then comes the clinical team. The clinical team makes sure we do the documentation, and if we need more authorizations, we're requesting those. We're keeping track of all that now in Matrix. So when billing does do billing, they have access to any authorizations, any notice of Medicare non-coverage, and to make it easier for them. So all the information is concise. We're not making phone calls. So this week I received a letter from Medicare. So now they're going to do our 5-claim probe audit. So basically all nursing homes in the state of Illinois are going to be audited. They want to make sure, obviously, they call it an ADR, additional document request. They want to see everything that we've done for this resident, all the care. So while this audit is happening, any Medicare bill that is outstanding, it's going to sit there. Medicare is billed sequential, correct? Okay, so then that means until the audit is done, then that money will sit up in the cloud. Our audit is done. Hopefully everything comes through okay. And then that, there's no issues. If there is issues, then we go to the second tier where we are educated. And if the bills continue to go out with issues, then that could be an issue for the building because they could go ahead and disenroll you in Medicare. Would that be? So it's just, I feel that I have educated the staff in Matrix where what are we looking for? It's got a little question mark. It does offer education on the side for the nurses. I have communicated with TCM regarding updating some of the nurse documentation that they need when they send a resident to the hospital. And so, I do believe that the nursing home needs a permanent administrator, but because there has been a lack of education for such a long time, now, I think a little bit is overwhelming, but it's baby steps, but we should invest more in our department heads and trust that they can do the job and give them the tools. So when I say give them the tools, I don't mean send them an email and let me know if you have any questions. I mean step by step. I have nursing friends and nurses have a 7 second, they have 7 seconds to be able to look at something and to be able to figure out, how to do something. So we are working on the nurse training. I have received information from TCM, and we are working on the orientation and competencies for all staff. But healthcare has changed, and some things have not changed at the nursing center, and we have to be up to date and caught up. And I think that when you invest in your employees, then they invest in you. If we don't make an effort, then the turnover will be high because we haven't showed them that we want them to stay. And so nobody wants to guess at their job. Nobody wants to fail. They just need to be educated, and everybody learns differently. So it is a little frustrating to me because even though I know TCM is a management company and they are very, very smart, I will not take anything away. But I think sometimes we have to be able to, you know, put ourselves in their place and make it so they can understand and then check on them. So it's just everybody learns differently. I just feel that the building should be more far along than it is. And I mean, that's my opinion.
Thank you.
Thank you.
I got a question, follow. How many people do you want trained in this?
Everybody.
Everybody, oh, okay. So this, what I'm saying is this for billing?
Nursing, billing.
Bill, the matrix environment is something we paid for before TCM was here.
Mhm.
That's, we own that software package, right? They use it to do the billing and a lot of the clinical data entry into the system. That's how we keep track of patients out there. So what we're trying to say, or what I'm trying to say, is we need our internal person trained on that system to be efficient in it, period. Whether or not TCM's there or not.
Because, I've been on the board back since 2002, and our business office manager used to do all the billing, but then, there was a lot of mistakes made also over the years, that we weren't billing properly, and stuff like that, So my concern is that, that if we're training the people, that we train them properly because, people do come and go.
Agreed.
And I know our business manager, how long has she been there?
6 months, 8 months.
9 months.
Yeah, they don't sit, well, we did have one there for a long, long time. After she left, there was some discrepancies that we found out after that.
Can I ask you a question, sir?
Yeah,
Who would be better at training our personnel than the people that design and develop the software?
I think our management company's qualified to train
But
people.
why would they be better than the software, the people that actually develop the software?
The billing side, they
Don't give me that. You can say that on
the clinical side, they do.
whatever.
It's very generic.
So
All I'm
Again.
concerned about is the billing side,
I understand. Bill, I've been looking at AR that's over $1 million for the last year and a half.
Tim, remedies in the contract.
All right, so moving on to old business.
Although I got some to ask yet. So I know I ask this every month, when was the last time you got a payment?
One payment between, that's month, this month,
For how much?
$8,000.
Should.
And then there was a $6,000 check off, an interest payment, and it was only one.
So this new one that you sent out that we owe you, $424,538.18 is up to date then? Minus,
Yeah,
so, okay then. Are you getting regular payments now or just hit and miss?
Georgia?
The treasurer did tell me she cut a check today, for 28,931.23. Is that the amount that you were?
So what will that take us down with all of it?
We can run a new report and send it out, if that's helpful.
Could you do that for me, please? Then I like to keep track of things, but
That it?
yes, thank you.
All right, moving on to old business discussion and update of the S and C handbook. It was sent out with the packets with the pieces after. Anybody have any discussion on that? Okay, saying none. All right, 10.0 public comments.
Casey Anthony. So UCCI, put together, I think it was a great idea. I know, going down to UCCI things, Jim Hart, myself and some other county board members talked about how great it would be to kind of get together and work together, and UCCI orchestrated that. I know that there's something going on in the other one, but UCCI finally had their first meeting this week. So I just wanted to share, it was great, to be part of hearing what other counties are doing. It was county board members plus nursing home administrators, Mr. O joined. So meeting, this is just a summary from, UCCI. The first thing, and, it's first for a reason, pay attention to billing and collection. Something that came out of it, very specifically, how billing and collection is the key to nursing homes functioning. And honestly, it was great to hear, because Mr. Filippo gave a little bit of information, but the other nursing home administrators were agreeing on how the cost report is important, billing is important, and if those things come together, and county nursing homes should absolutely not have any issues functioning and staying operational. Also talked about just the importance of reaching out to the hospitals in the local area to market your nursing home, market yourself to the community. Raising salaries to be more competitive as an employer as some costs are reimbursable because you do just like Mr. Filippo explains, you do the cost report at the end, and then you just give the money back. So whatever you're expensing, you end up getting back. Inform potential employees about IMRF. I know we've talked about this in committees, but a benefit only county-owned nursing home employees can receive. How important it is to be as quick as possible in responding to hospital inquiries about possible residents, because that's how case managers in hospitals decide which nursing homes they're going to reach out to. Consider reaching out to other services, so memory care, different things like that. Reaching out to state representatives and senators about the importance of county nursing homes, and supporting House Bill 5537. So those were the things that came out of that meeting, and it sounds like we're going to meet monthly. If you want to join, that's all you have to do is email UCCI, Susan Hilton. She is the Director of Government Relations for UCCI. I know that Nicole is part of it, George is part of it, Jim Hart's part of it, but it was great to kind of hear. So Will County and Piatt County are doing phenomenally. And they credit their success for having a supportive county board. They said that countless times how they didn't know how they could do that work without the support of their county board. The other thing that I wanted to talk about is how we have county board members reaching out to services that we contract with. We're an oversight committee. It really should be either the county nursing home administrator or the nursing home administrator. That we should be coming from them or working with them to do it. We should really be doing that first.
Any more public comment? Seeing none, thank you, Casey. That was on my notes to bring up the UCCI call and have Mike speak about what he spoke about, but she touched about that. Any more public comment? Seeing none. 11.0 adjournment.
Motion to adjourn.
Mr. Hadley, do I have a second?
Second.
Mr. Whalen? Any discussion? Seeing none, all those in favor say aye. Opposed? Have a good evening.
Okay.
I was gonna say, Robbie, are you okay?
Yeah.